I'm here today to talk to Dr. Christopher Love, one of Australia's leading specialists in men's health. With over 25 years' experience as a urological surgeon, he's now regarded an expert in the broader field of men's health. So, Dr. Love, you're a men's health specialist. Why is that such an important issue?
Well, men's health's always been important, but I think it's now getting, and rightfully so, a higher profile. Men traditionally are not very good at going to the doctor, and they often ignore their health issues. In fact, in the last 12 months, 16% of men in Australia did not record any Medicare activity, implying that they never went to a doctor or a chiropractor or any health practitioner. And that's nearly 1/5 of all men in Australia, and that's still really not a good enough figure in this day and age. I think the problem is men have always regarded themselves as being a little bit bulletproof, nothing goes wrong with them, but the statistics really belie that. 40% of men over the age of 40 already have a serious health concern, diabetes, high blood pressure, and we really need to do a lot better. Men don't go to their doctor as often as women. Men tend to downplay and ignore symptoms, and often those symptoms can in fact lead on to a more serious condition. So we really do need to raise the profile of men's health and encourage them to go to the doctor and seek help.
What can be done to make those statistics better?
I think a lot of it is education, a lot of it is making men feel perhaps less ashamed to go and ask for help. Particularly when you get into the area of mental health, there's been a real stigma about men thinking there's something wrong with them and they wouldn't seek help for that. I think we need to sort of educate men, make them aware that it's quite legitimate to be unwell and to have treatment for it. Specifically in the areas I'm involved in, and I come from the background of urology, there's a lot of areas now that men are a bit more aware of, prostate cancer being a large one, but we've really started to understand that a lot of men's health issues are indeed integrated. If, for instance, they're diabetic, they're more likely to have heart disease. If they've got heart disease, they're more likely to have erectile dysfunction. There's a thing called the metabolic syndrome, which is a combination of things including obesity, changes in cholesterol levels in the bloodstream, high blood pressure, diabetes, and there's really an epidemic of the metabolic syndrome. And all these things then relate to an increased incidence of cancers and all sorts of other health issues. Sleep apnea, for instance, is more common in men that are overweight, more common in diabetics. So we've really started to integrate all these areas together as men's health and trying to raise the overall profile.
And how did you get involved in the field?
Well, as a urologist that's a specialist in the urinary system and the genital system in men, urologists have always treated some of these areas. We treat men with prostate disease, we treat men with prostate cancer. But as we've started to understand the correlations between those and other areas of men's health, we're starting to be a little bit more holistic in our approach. And I think urologists really need to be the ambassadors for men's health. We need to be the forerunners in promoting this and educating the public. I think we're ideally in a position to do so because we're trained in the surgical treatment of these conditions. So certainly my interest is in trying to promote the overall image of men's health, to really get men to see their doctor, to seek treatment early. And as a urology specialist who now specialises in men's health, I can provide them with care and treatment in a broad range of areas.